checking off Brian McAfee.
Katie Brackett. Alright. Hi. Alright, well first I would wash my hands, instruct the patient. My name is Brian McAfee. I will be assessing for your head, neck, and lymph nodes. May I have you state your date of birth and name?
Tim Fink, 4492.
Okay, that's great. Well, we're going to go ahead and inspect the patient's head for any abnormal features of symmetry. Symmetry seems to be aligned from the midline. No twitching of the head. Neck is upright with the head. And no lesions of any sort. Moving on. Palpating the patient's scalp for any lesions, manifestations, and bumps. At our convenience, we will check the post-auricular, the pre-auricular, and the occipital lymph nodes. Okay. Next, we will assess the patient's TMJ. Tim Fink, Mr. Fink, open and close. Okay. This indicates that the patient's TMJ is free of motion and no abnormal clicking. Next, we'll assess the patient's parotid glands, submandibular, tonsillar, sublingual, and submental lymph nodes. When assessing the patient's lymph nodes, it's important to note the size, shape, sensation, surface area, spread, and symptoms. Also note any kind of heat, tenderness, and red streaking in the lymph node areas. Now I'm going to be assessing the patient while palpating his anterior cervical chain. This is done bilaterally. Posterior cervical chain, and underneath the sternocleidomastoid, which is the deep cervical chain. Palpate against the supraclavicular chain area for lymph nodes. They're just findings at present, but none. Bilaterally done. Moving on. Assessing the patient's lymph nodes. It's important to assess their axillary area, inguinal, and the epitrochlear. Moving on, I'll be testing you for your cranial nerve, number 5, trigeminal. When doing this, I will use this applicator to test sensation, the nerves, the temporal, prefrontal, and the maxillary. This is done. Have you felt that? Okay, the patient notes that. He's felt sensation. He's normal. Also, testing the masseter muscle. Feel it and move your jaw up and down, side to side, and protrude it. Okay. Masseter muscle seems to be in place, and no abnormal reflexes, which would predispose to hypercalcemia, spastic sign, not noted. Moving on, I'll be testing the patient's cranial nerve, number 7, which is the facial. Ask the patient to smile, frown, make a kissy face, fish face. Okay. Raise your eyebrows. Okay, close your eyes, eyelids. Try to open them. So, cranial nerve number 7, facial muscles, facial nerve cease to be intact. And moving on, assessing the patient's trachea. I will place both of my thumbs against the midline, finding the cricoid cartilage first. Seems to be midline, intact. I'll ask the patient to swallow. Watching the Adam's apple move up and down at a more prominent stance. If there is a tugging sensation that synchronizes with the pulse, this suggests Oliver sign, Cardarelli sign. After the trachea has been assessed, no tenderness has been noted or bumps. I will assess the patient's thyroid. Go behind. make an angle, and lightly palpate while the patient turns his chin the opposite direction. This is done bilaterally. Okay. Patient's thyroid seems to be normal. No tenderness noted on both sides. Next, I'll be assessing the patient for jugular vein distension. I'll ask the patient to bend his chin down and move it to the side laterally. This will promenate the carotid arteries. First, I'll palpate against it. No abnormal pulsating or distension of the veins. Seems to be fine. Okay. Next, I'll be auscultating with the bell of the stethoscope. I will listen for bruits in the patient, in the temporal arteries. Okay, and next the carotids. Have them bend down again. And both lobes of the thyroid. No bruits noted. If bruits or blowing sounds were heard, this would suggest an expanding cerebral aneurysm. Next, I'll be assessing you for your range of motion. Look up. Okay, this would hyperextension. Look down. Flexion. Look straight. Okay, that's extension. And move. Resisting, moving side to side. Okay. Try to do a lateral bend. Push. This way. Okay, there we go. Next, I'll be testing the strength of the sternocleidomastoid by having the patient press against my hand with his forehead. Press back. Okay. And again, like I said, press. Okay. And finally, cranial nerve number 11. I'll have the patient shrug while resistance. There we go. And anything else? That concludes the assessment.